Hey, what's up everybody, and welcome back to the Sanctuary. I'm your host, Professor C, and we're going to continue our A&P lecture series today by looking at more muscles. Specifically, we're going to talk about the muscles that help you breathe, known as the respiratory muscles. So let's check them out. Breathe in, breathe out. Seems pretty simple, and really of all the physiological things we look at in an A&P class, breathing in and breathing out is actually one of the more simpler things to learn, including the muscles of respiration. So as you can see over here by this person's smiling face that she has no trouble breathing in and breathing out. If you are watching this video now, say at your house or driving in a car or something, you're probably breathing in and out fairly easily, meaning I can't hear you, I don't hear you huffing and puffing, right? So this concept of good breathing is called root word U for good, and then add the root word for breathing, pnea, and you get a funny word that's pronounced eupnea, which means good breath. If you were to say, have some trouble, maybe have asthma or COPD or something, and you hear somebody having difficulty, would put a different root at the front, would put dis, meaning crazy, right? Use the same word for breathing, and we have another word here, dyspnea. Dyspnea is troubled breathing. Quite simply, it's all about the diaphragm. It is a large rainbow-shaped or mushroom-shaped muscle situated where you see in both of these images. It does serve as an anatomical landmark. One of the first ones you learn when you start taking an A&P class is above it is the thoracic cavity, and below it is the abdominal pelvic cavities, or specifically the abdominal cavity. So it is the landmark, the partition between those two major cavities in the body. It is arguably, the diaphragm is the most important respiratory muscle. Without it, none of the rest of it will happen. So what happens is when you decide to inhale, right, which the fancy word for that is inspire. When you decide to inspire, it's a passive event. This diaphragm flattens, and I'll just kind of show it like that, not to be correct at all, but it will flatten. And as it does that, it will open up the rib cage long-wise, right? We'll have some other muscles in a minute that will pull it open to the side, but it will lengthen the rib cage, and this will allow air to rush into the lungs passively. You don't actually have to suck air in as you breathe. As you relax this muscle, you will then blow air out. This is sometimes called exhaling, but in fancy science terms, it's called expiration. It's still a passive event. You don't have to actually blow forcefully to expire that inspired air. Just to get technical, the origin of the diaphragm is in the pleuroperitoneal folds, which is a fancy way of saying it's got something to do with the way that the lungs and the abdominal wall are folded up together, and this is where it originates. And it is innervated by the phrenic nerve, not one of the cranial nerves. Externals, intercostals, again, inter meaning in between, costal referring to the ribs. So we're talking about muscles that are in between the ribs, and the way it works is the externals help you inspire. They help you breathe in. It's kind of opposite roots there. So we're seeing in both of these images pictures of the external intercostals. Technically this would, that would be one, this would be one, this would be one, this would be one all over here. Those would be different muscles technically, but we're just going to talk about them as a group. They will originate on the lower border of a rib, and they will kind of grow to the upper border of the rib below it, if you want to think of it like that. We'll see the internals flip it in a minute. These will elevate the ribs, as we said, for quiet inspiration. This will, if this is you, wonderful looking you, the diaphragm will help you open your rib cage lengthwise, and the external intercostals will help you open it widthwise. And again, this will help air rush into your lungs during quiet or passive inspiration. Intercostal nerves are branches of spinal nerves. We'll get to the details of that in the future, but they are innervated by intercostal nerves. As far as the internal intercostals go, these will help you exhale, right, or expire, but only forcefully. You don't really need these when you're doing quiet or passive inspiration, expiration. These will originate on the upper border of the rib, and they will kind of grow up to the lower border of the rib above it. Their job, again, is not to help you inspire. These are for forced expiration. Say you're going to blow up a balloon, right? And you need to blow the air out forcefully. Their main job is to hold the rib steady during these events. And these two are innervated by intercostal nerves. As far as labored breathing goes, and it could be that you have some sort of respiratory disorder, or it could be that maybe you just chased your dog down the block trying to catch it, and you're huffing and puffing like this, you will use different sets of muscles. So you may even, besides the internal intercostals, you may use something like the sternocleidomastoid, a neck muscle. You may use a shoulder muscle that we haven't seen yet called levator scapulae. You may use abdominal muscles. In fact, put your hand on your abdominal muscles and blow very hard. You can feel that abdomen compressing to allow you to do that. So when you're huffing and puffing, it's going to be a different set of muscles than when you're just quietly breathing. All right, hope you enjoyed that talk on respiratory muscles. Thanks for watching it. Check out some other videos in the series if you want to learn more about ANP. See you for the next one. Bye-bye.